Today's skills are going to be care of the neonate. We're going to do weight, head circumference and length, nappy care, nasogastric insertion, taking vital signs, and wrapping and swaddling. So I have my Rosasa baby here, a little bit big for the general neonate. We're looking at about 4 to 5 kilos here. And we are going to just do some basic care with it. So to begin with, I'm going to show you how to do a head circumference. Most of the time we like to use disposable paper measuring tapes, so we can use a new one on each baby. So you want to go around the biggest part of the head and then meet at the forehead with your legs so you can see them there. And then you're looking for the closest number that hits on the number 0. So we've got 38.5 for this baby. You can see here I've got it around the biggest parts of the head. Whenever you're doing a weight, the baby needs to be bare, and that's including nappy. So nappy is always off for the baby when you are doing a weight. So we're nice and bare. I'm going to lift up from the legs, pop on the scale, and then we have our first bare weight. And this needs to be recorded every time a baby comes to see you. When taking the length of the baby, have your measuring tape on a table or have one of the table measurers, and you go from the top of the head to the end of the outstretched leg. So bending out that knee and taking it from the heel. Sometimes this can be a 2-person job because you need to keep the head straight as well as pulling out the end to the leg. The next thing I'm going to quickly show you is how to put on a nappy. For those who haven't worked with babies before, it can be a bit of a different skill for you to have. So when taking off the first nappy, always have your clean nappy underneath and ready, because babies notoriously like to go once the nappy's off. As soon as they're exposed to cold air, they will usually wee, if not poo. So have your other nappy underneath and ready, and then you're pulling out and flattening and pulling the tabs in. So it's really important that we make sure that we're sealed around the edge with our little fluffy bits out to stop from leakage. And it's also really important to note whether there's any creasing or anything on the back. This can reduce pressure injuries if a baby especially is in hospital and is going to be spending a lot of time on its back. Our next skill is measuring and inserting a nasogastric tube. So for this baby at this size, you're looking at probably an 8 or a 10. If the baby needs a really big nasogastric, I would go for a 10. And these days they're looking like this with our purple adapters. Purple is the universal colour for enteral. We are finding the very first hole on the end of the nasogastric and lining it up with the nostril. We then go down to the earlobe and down to the sternum. Just below the sternum is where you want to take your measurement for. So on here I can see that I'm measuring to 27 centimetres. Then what I'll do is I'm not going to use lubricant because thick lubricants can often block up the airway. So I'm just going to lubricate with a bit of saliva from the baby. I'm then going to enter down the nostril, the same side that I measured from, and slowly push, 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 until I get to my 27 centimetres, and then I'm going to tape the baby's face along here like that. The way we check that the nasogastric tube is in the right place is we don't send for x-ray because we don't want to expose kids to unnecessary radiation, because we've got other ways that we can check. So the first thing that we do is once the tube's inserted, we can get an oral syringe and just try and aspirate back some stomach contents. You only need about ½ ml, and if you can get that and pop it on a pH strip, we can test to see if it's stomach acid. You're looking at a pH that's quite high, so really acidic. And then you will know it's in the right place. This is the gold standard of checking if your nasogastric tube is in the right place. The next thing is a little bit different. It's how to take vital signs in a baby. Mostly we rely on our primary assessments for babies, so that's looking at our fontanelles, so touching the top of the head up here, and doing a capillary refill. So for 5 seconds, pressing down in the centre of the chest, and then releasing and counting how long it takes until the perfusion comes back to normal. We spend a lot of time using our femoral pulses to take pulses. We need to know that they're strong, and we will also auscultate. So when we're auscultating, we're looking at least 4 parts of the lungs. And then if you've got any concerns about the baby's digestion, you can definitely go and have a listen to the bowel sounds in all 6 quadrants. If you're doing a very thorough focused respiratory assessment, you can turn the baby over and have a listen with your stethoscope on the back of the lungs as well. Babies under 4 weeks, make a habit of having a listen to the heart sounds, so you can turn your stethoscope over and use the bell and have a listen for any advantageous heart sounds here as well. As far as taking actual vital signs, we have a few different pieces of equipment that we can use. This is a baby stats probe, and it can just stick on the foot or on the hand, wherever you'd like. Some places you'll find we use sticky tape to keep these ones on because they can stay on more than once. I like to use this soft little posy. We've got baby ECG dots, which can sit on the baby up through here as well. And then to keep all our cords out of the way, we like to wrap it around the side of the nappy, and then it can come out through here. And finally, we have small blood pressure cuffs. You can take a blood pressure anywhere on a child. For kids, we tend to go for the leg as well, but you can also do it on the arms. You just need to find a blood pressure cuff that will fit. This is a size 4, so good for a 4-kilo baby, but we do go down to as small as size 1s. So this is what a baby could look like with a bunch of the monitoring. It's important to note when we're taking a temperature from a baby, we only ever do PA. So that's turning your thermometer on, popping it right in the crease of the armpit and holding it there. You need to turn the thermometer on and off probably at least 2 times to make sure that you're getting a really accurate temperature. It's really important to monitor a baby's temperature because, as we know, they lose heat very easily, and they don't have to store as adults do to keep themselves warm. It takes a lot of energy for a baby to keep itself warm. And our final skill today that I'm going to briefly go over is how to wrap and swaddle a baby. So I'll just do my baby back up. So this blanket is a little bit small for our baby. So what I'm going to do is I'm going to fold over one corner a little bit, and then I'm going to have a new middle. So I've got my corners over here. I grab my baby. I have a few things attached to it at the moment. And I want its shoulder line at the top of the blanket, so up in here. Then what I'm going to have is I'm going to have our baby's hands on its chest, never down by its side to help for shoulder development. So over on its chest, and I'm going to pull nice and tightly around the baby, tucking in on the other side. And same with this side, pull nice and tight and tucking underneath. What I'm also going to do is I'm going to leave the legs free. I can fold up around here, but I'm not going to tuck really tightly. This is going to help with our hip development. The baby needs to be able to kick a small amount for good development. And then we have a nicely swaddled baby.